Hello. I'm waiting just to make sure we're live. I have this spinning circle that comes after the countdown. So I'm going to go ahead and start talking. So I just wanted to pop in today and talk about something that people have been asking me, which is a very good question. Should you pay for peer consultation? And the answer I have to that is it really depends on your personal preference, and also it depends on your circumstances. Sometimes people want to join a peer consultation group because they want it all done for them. They want to be put in a group where they know it's going to be facilitated and managed. They just show up. They can bring their cases. They can provide feedback for their colleagues that they're going to get to know and trust, and they really like that model. That's the type of model that I offer. I also have experienced one-on-one peer consultation over the course of my career. There's certainly some advantages to that. One of the downsides of that very often is that it doesn't happen regularly. It was more of like, hey, can you hop on the phone real quick? I need to talk to you about a case, which can be fine, but it doesn't give you that regular time in your calendar where if you're having a case that's causing a little bit of difficulty for you, or you just feel like you'd like to have someone else's ears on it. You don't know that, like, hey, next Tuesday is my group time, and I know I'm going to be able to discuss it then, which can be something that can give you some peace of mind. The other thing is, I remember years ago, I was given the advice that if I wanted to see a patient or a client as a pro bono client, I should consider charging them something. And I've actually been given this advice in several different areas of my life. And the reasoning is something like this. When you give something for free, it oftentimes doesn't hold much value. Even something as simple as $5 or $10 can create enough value for people that they are going to make sure that they get it on their calendar. They're going to be a little more committed to showing up. So when you have paid consultation groups, you know that when you show up, others are going to be there. You can count on them. And I would say for our groups, most of the time, most everyone is there. The model that I researched and created is that we have 6 to 8 clinicians in each group. And that way, if you have 1 or 2 people who aren't there, you still have a good between 5 and 7 people that are. And the benefit of that is that we get these really, really rich conversations. It's been so interesting and wonderful to see the hive mind that gets created. Someone will present a case, and a couple of people might chime in with questions, getting some more information. And then someone's going to start with a perspective of, well, have you looked at this? And that will make another person think of a different perspective, a different theoretical orientation, or a different treatment modality that they're using. And we see these conversations where most of the time we get all of the members chiming in and having this conversation and these really, really deep conversations about the case, which I feel like it's just, it's got to be so beneficial to our clients. And as clinicians, it's incredibly beneficial to be able to grow and learn from all these other colleagues. The model that I use for putting together the groups is that I have a mix of newer clinicians who they don't have a lot of experience, but they've got that passion and excitement, and they just love that they've begun this career that means a lot to them. And then you have the more seasoned clinicians who have lots of experience, but maybe they're a little burnout, maybe they're a little jaded. So they're giving the advice from their experience to the newer clinicians, and then they're getting infused with all that energy and passion. And it can help with feeling jaded at times. There have certainly been some times in group, I don't participate in the groups as bringing cases, but I do facilitate the groups and join in the conversations. And there have been certainly some times as maybe a little more jaded clinician that I would hear someone's perspective and think, wow, that's really refreshing. I remember when I used to feel that way as well, and it's a good reminder that it's not, sometimes we look at it from our own perspective, our fatigue, maybe not meeting our own needs enough and things like that, and it's so good to have those reminders from people who are a little more fresh in the work. So having the groups regularly scheduled is really important. So the group members, one of the things that we talk about when I do the onboarding chat with members, we talk about the culture of the group. And what I'm creating has a culture that's very specific and very important. And part of this came about with the murder of George Floyd, right when I was transitioning from doing the free COVID groups that I had been offering to offering this paid membership. And it became so very apparent to me that we had to find a place for therapists to have a culture where they could feel trust, where they could come and know that they might not have the right words, but people weren't going to be cruel to them. They were going to be curious and ask questions and give them the benefit of the doubt. There was going to be no fear mongering. There was going to be no talking behind people's backs. And so part of the onboarding conversation I have with every single person who joins peer consultation groups is exactly that. This is what we're trying to establish. We're going to give someone the benefit of the doubt. If someone's using terminology that's maybe outdated, we're going to gently correct them and let them know why that's a better way to use that. If somebody is talking about something that's in a gray area that you're uncomfortable with, then we ask questions and we clarify and we offer suggestions about how to manage things. It's not uncommon at all for us during cases to make the recommendation, hey, you should probably check in with your liability insurance about that, or you should check in with your governing body, your licensing board about that to make sure you're covering all the bases. And so along with the groups, I also created a paperwork packet that I call the Peace of Mind packet. And that includes forms for you to gather all that information on a place, to gather all the information about the colleagues that you work with that you can contact if you need some guidance on a case, your governing body, your professional body, the phone numbers and access points to licensing, that are the professional liability insurance company, all of those things that you need to be aware of as points of gathering information to make sure that you're covering all of your bases. What I find is that most clinicians do a really good job of covering their bases. What we don't do is a really good job of documenting what we're doing. So the packet includes forms for documenting. If you get case consultation, then there's a form to document that information. If you are talking to your licensing board, there's a form to document that information, or your liability insurance. And getting those things in a way that you're documenting all the things that you're doing to manage your case, then you can sign it and put it in your client's chart. I think that that's a little bit of a weakness for a lot of us for our training, is that we're a little more casual about that. And most of the time that's probably okay, but in the trainings that we go to around ethics and things like that, they will always say that if your management of a case or the way you're performing your job is ever called into question, you're going to be judged against your peers. Would they have done the same things that you're doing? Were you providing reasonable care? And if you have documented that you have talked to your governing body or your licensing board or your liability insurance company or some of your peers, and you're putting that in the case, then that's just going to strengthen your position as far as showing that yes, you did consult with these other people, and this is how peers would have responded in the same situation. So having people to have that regularly scheduled group each week where, twice a month is how we have our setup. So you know that on the first and third week of the month you're going to meet with your group, or the second and fourth week of the month you're going to meet with your group. It can give you that peace of mind that, okay, this isn't urgent enough that I really need to talk to someone today about a case, but I am going to jot that down because I do want some consultation around that, and it's nice to know that it's there and it's available. I also want to create a wraparound community for people and Oasis for therapists. And what I mean by that is when you are put into a group, you are given a roster of your group members, phone numbers, and email addresses. And the reason I do that is that I encourage outside of group interaction. These are the people that you're going to be getting to know and trust, and these are the people that you're going to feel comfortable with saying, hey, shoot out an email. Hey, I had this case today that I just feel like I need to talk about it with somebody, and our group is not meeting for another week or two. Can anybody hop on the phone with me? And so that way you have that community of people that are there for you. I also have created a private Facebook group that is only for people in Oasis for Therapists. The benefit of that is that this is a therapist group where you know they're like-minded people. There are people that have agreed that I want to be in a group where we foster benevolence, where we foster trust, where we work together to support each other. And this is going to be a group where if you ask a question in the Facebook group, there's going to be fear-mongering or people being judgmental. That's not the culture we've created, and I feel confident with interacting with all the different therapists that are in our groups that that's just not going to happen in our Facebook group. And if it did, then that person's probably not going to be participating in the program anymore. You know, I'm going to know this person, we're going to have a conversation, we're going to, you know, I'm going to try and give them the benefit of the doubt, but the bottom line is we can't have the type of culture for our community if we have those types of behaviors happening. And I know that that's a tremendous problem in a lot of the Facebook groups, and the moderators do a fabulous job. They really do. I have so much respect for moderators of so many of the therapist groups because they deal with some stuff where people are showing up and they're not being professional and they're not being supportive all the time, and that can be really challenging. So those are some of the things, the answers that I have for peer consultation, whether or not you want to pay. It's a personal choice. My honest feeling is that everyone should have peer consultation in whatever way, shape, or form works for you. If you can do it for free and you can make it a regular schedule on your calendar, which is a good idea, then go for it. If you would like to be in a program where it's all taken care of for you and you get this wraparound community, then that's great too. So I'm not trying to say that everyone should pay for peer consultation. What I'm trying to say is that there are circumstances in which it's beneficial for people to pay for peer consultation. And so, again, it's a personal choice, and it's come up a few times, and I just thought it would be something that I could share with you all, give you some perspective on why I created these groups to begin with, and in, you know, some of the research that was behind how I put the groups together and the safeguards that we have in place to make sure that it's a safe, trusting environment for all of my participants. All right, so just as a reminder, enrollment is closing in 2 days. So on September 24th at midnight, enrollment will close. There will not be any more open enrollments until next year probably. If you've had any thoughts about it and you'd like to chat with me, there's something that's holding you back or you're not quite certain about it, I'm happy to chat. Just message me or shoot me an email. If you receive my emails now, all of them have had a link to my schedule, so you can schedule a chat with me. I'd be more than happy to chat with you. And I've also been sharing some of the feedback I've gotten from current group members. And so if you have questions for the group members, if you are in the peer consultation group for therapists and Virginia Online Therapy group, then it's a mouthful, it is. If you're in that group and you want to ask questions there directed to the group members, I'm sure they would be happy to answer your questions as well. And then if you go to my website, oasisfortherapists.com, you can look at the replay of the open house where I explain in a little more depth and answer questions about how the Oasis for Therapists peer consultation groups work. Thanks. Bye.